Hi, this is Aoife from Women's Health Dublin.ie. Today I'm going to talk to you about pregnancy belts. So, quite a lot of the time during pregnancy, it's very common to get pelvic girdle pain, which could be pain at the front or the back or the pubic bone, or just feeling like the weight of the bump and the baby starting to push things down a little bit. Not everybody gets it, but it is really, really common, and especially as you get towards the end. This is my second pregnancy, and I'm definitely starting to feel a little bit earlier in this pregnancy, which they say is common. So I have a couple of belts here I just want to show you that are just options, and what everyone likes can be different. It just depends on where you kind of get the compression or the lift or what it is you're looking for. So this belt is called the baby belt, and this is from Diane Lee. She's this amazing women's health and pelvic guru over in Canada. She's a physiotherapist. But she developed this belt and it's available online, and it's really sturdy because there's loads of attachments, and that's why I put it on first, because it's kind of hard to get on. So we've got a little part that comes around the front, and then that kind of attaches around the back with a little bit of elastic, and then you get this big part here that has the lovely core sitting at the back, and you attach that firmly around the front, so that really gets those hip bones or your pelvic bones in the front of the pelvis. And then we still have two more pieces here that we can attach and bring to the back if we want, just to give a little bit of compression at the back. Now, for me personally, I don't love that compression at the back. That compression at the back can irritate me, so I more prefer that support at the front that kind of lifts up the bump. So I have a bit of a lighter, duty one for that, which I just got on Amazon. It's really cheap. I'll put up the link to it. And this one comes just for under your bump. So again, much lighter duty, really elastic, one size fits all. I suppose it just grows, and you just wrap it underneath the bump and attach it. So again, it nearly just lifts up your bump, and for me feels like it's just taking a few pounds off my pelvis, and that really helps. So maybe because I have weaker abdominal muscles, I really kind of just in my genes, stretchy fascia, connective tissue. So that's something that even though I'm doing loads of strength work, my hormones are just creating all that looseness and floppiness of ligaments and connective tissue. So everything just starts to drop. So a little lift for me is, really helps me a lot. One more to show you, which is probably the most popular out there. It's called the Sorolla belt. And this is common even when you're not pregnant or after pregnancy, when people continue to have pelvic girdle pain after baby's been delivered, because most of the time the pelvic pain is gone, but sometimes it's not. Now this one again depends on where you want the support. Sometimes you might feel it better down around your actual hips, which is lower, and attaching it down there. And then we get these two again big Velcro straps that you really have to pull around the front. If you don't get them around the front, then it's not doing its job. So if you get that and attaches lower, it might give you great support. You might want to put it up higher on the pelvis, or sometimes people want to turn it around. So actually just closing it completely at the back, and then they get all their compression at the back, and that's what really suits them. So I do tell people Sorolla, it's amazing belt when you have that problem, but it doesn't just fix every pelvic girdle pain. And the thing about these belts is now they're great for walking, great for standing a lot, which obviously I do in my job, but not great when you sit down. They do start to get uncomfortable. So just be mindful that they might be better for long walks or when you're standing a lot. Hope that really helped. I'm Aoife from Women's Health Dublin.ie.